Hey there, welcome back to Elements in Focus. So good to be with you today. Big topic on the docket, covering health insurance costs after employment and before Medicare. Arguably one of the largest discussions we have with our families entering the distribution phase of finance. This is a massive cost that can essentially trigger right before Medicare begins. And there's no better person to come on and talk about this. Our Director of Financial Planning, Aaron Rheaume, and my partner in crime, or PAC, as the kids say. So, Aaron, thanks for coming on and covering this really important topic. And so, when we look at retiring before Medicare and all those insurance techniques and tools that are available, what are some of the things that we need to be thinking about when we engage in this discussion?
Yeah, Grant, as you mentioned, this is a conversation that we have very often because it's you have that transition period before Medicare kicks in at age 65. And as we always say on our Elements and Focus videos, as we're discussing information, we're talking about broad topics. But in order to make this specialized and specific for you, we would have to engage in an actual conversation to understand all of the avenues that we need to uncover to make sure we're providing you the best advice. Things like what type of health are you in? Are there medications that you're taking? What savings have you accumulated over a period of time? How are your benefits structured currently at your employer? And is there COBRA coverage? So those are just some very, very quick things. But if we were to address this situation, there is a series of questions that we would ask. One is, how old are you? So are you retiring at 62? So we've got a 3 year period of time before we get you to Medicare. Are you retiring at 55? Now we've got an 8 year or a 10-year window of time to get you to Medicare. And so those are things that we want to understand first is what is the period of time that you're going to have to essentially bridge yourself to Medicare. Once we understand that, then we can go down different options. Some of the options that have been discussed in the past are COBRA insurance. That's where you can carry on your actual employer insurance for up to 18 months. It gets exponentially more expensive. So if that's a route you're going to take, we have to just outweigh the costs and the benefits of doing that. You could go to the excuse me, you could go to the marketplace and look at what the premiums would be and plans on the marketplace. There's often been times where we've been able to control folks' income in a way that we can essentially have their health insurance paid for free. But if you're going to go down that route, there are very, very specific rules that you have to pay attention to when it comes to the Affordable Care Act premium credits that you get. So if that's a route that we're going to take, we have to pay attention to how much income is going to hit your tax return. I'm not going to go into the specific dollar amount because it changes all the time. Just know that they look at the poverty level, and if your income is above 400% of that, then you could lose the Affordable Care Act triggering credits. Medishare or private type companies. A Medishare is not an actual insurance company, it's a sharing plan. So if Grant and I were both part of Medishare, and just like millions of other people are, and I have a health expense, I pay a monthly share premium into that plan. And then anything over and above my annual limit, all of the participants in Medishare help pay for the cost of coverage. Uh, what else am I forgetting? So we've got Medishare grant, we've got the Affordable Care Act, we've got COBRA. You could self-fund it. Probably not the best option, but if you have an HSA account, you could just say, well, I'm healthy enough and I'm just going to kind of roll the dice and self-fund health insurance. Probably not the best option, but some people have the ability to do that. Um, there are so many different avenues, and it really just comes back to understanding your specific situation. We do get this question often asked, and the way we respond is to helping you through that specific situation. It's our job to have the knowledge, it's our job to guide you in the right direction, and we do this almost daily with folks that are moving into the distribution phase. So, Grant, I'm going to pass it back to you. I covered a lot of information in a short amount of time. So anything that you want to add that I potentially left out?
Well, you always do a very good job, Aaron, of covering it from a very high level perspective and letting everyone know who's viewing. It's a very in depth discussion, and you have to get nuanced because health is nuanced. The only other thing I would add is that you can also go direct to carriers. And sometimes when you're evaluating direct to carrier, why would you go that way? Well, if we're not getting any credits from the marketplace or the Affordable Care Act or Obamacare, some people affectionately call it, then going direct could be a way to save costs because you're not using the exchange. Now, again, there's some nuances to Aaron's point, whether we have to be very close attention to. And sometimes, depending on the health of an individual, catastrophic care, Medishare care is not bad to help you bridge that gap. In COBRA, everyone talks about how expensive COBRA is, but Aaron, sometimes when we start evaluating those other alternatives, COBRA may sometimes actually look very captivating. So there's a lot of discussion that needs to go on in this topic. And if you're looking to engage in that discussion, please reach out to us. 800-928-4001. We have a very talented advisory team that is ready to take your call and address this with you. And we are going to ask to have you schedule a complimentary next steps meeting to discuss this because of the weight of the conversation and the amount of variables that we have to dive through together. We also, if you have just basic questions like what is the Affordable Care Act? Never even heard of this, or how can you go, what is a direct plan? Shoot us an email, talk to FEG at yourlifeafterwork.com. We're more than able to assist in that conversation. And there's a lot of other great material that Aaron and other of our qualified team members have created that you can find on our website, yourlifeafterwork.com. So again, thank you for being with us in this very heavy topic, but one that is absolutely necessary. All of us at some point will be on one of these programs, including Medicare. And so not afraid to have this discussion with you. Hope you have a wonderful day, and we appreciate you tuning in.